Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's overall health, the MyoHacker podcast is your guide. Hi, I'm Karindy, a speech-language pathologist, myofunctional therapist, and a mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this important information. Visit myohackerslp.com for free resources and guides. Quick disclaimer. The content shared in this podcast is for information and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult a professional regarding your circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. Now, let's dive into today's episode. Welcome to the MyoHacker podcast. Today, we are going to have a special quickie episode in which we are going to talk about a few ways that you, as a myofunctional therapist, a CFT provider, someone that is involved in the airway space, can really improve the quality of your care and facilitate self-care for yourself as you grow your practice. So we want to be really leaning into just awareness of the energetics of the body. And if you tuned out, that's great. Go listen to something else. But if you're like, what does she mean? Hear me out. So when you are doing, let's say, a body scan of the way the body's moving, of how someone is breathing, how they're swallowing, how they're walking, which we want to be looking at all of those in one of our assessments. I want you to feel in addition to observe. So what that can look like is as you're watching someone move, someone breathe, are you feeling tension in your own body? That can be a way that you're tuning in. And basically what it is our brain can pick up so much more information than we can even logically suss out. So we might actually be seeing cues of movement, of breathing, of mechanical issues that if we had to stop and describe it in that moment, we might not be able to. We might not be able to fully give that information. So as providers, we're often taught, if you can't explicitly describe it and clarify it, you need to ignore it because it's not evidence-based. You can't scientifically, clarify what it is. I'm going to challenge you that I think you can, but it's going to take a little bit more time. It might not be immediate. So what I want you to do is sense and feel what you are sensing in your body. That is not the only metric, because maybe you have back pain and all of a sudden you're like, oh, is that it? That's not what I mean. But when you're tuned into how your body feels, and then you're tuning into how you feel it in response to what you're observing, that can be one clue. I also want you to notice if you are doing a body scan, and it doesn't have to look like you're quiet. Anyone that's been in my sessions, they're usually fun. We're joking, we're laughing, we're enjoying ourselves because, goodness, we need to. But it is, as you're observing, are you feeling a pull to notice something? And sometimes this can be obvious. Let's say in a case of someone with, severe scoliosis, of course you're going to notice that they're breathing through one side of the rib cage more than the other. You're going to notice discrepancies in height in the hips, things like this. Yes, of course. But I really want you to sense, what is it that your brain, your nervous system is picking up on that you need to just take a minute and give space to. So what that can be is, let's say you do want to see, how do they breathe in response to cueing on one side of the body? Okay, how do they, breathe in response to positional changes? You have them lay down on their back, on their side, and you're noticing, okay, I'm feeling a lack of movement in, let's say, this side of the diaphragm, or other things. I want you to not disregard that, give it space and slow it down. So we don't have enough time to cover all the areas of assessment that we want in our sessions anyways. In a dream world, we could spend 3 hours looking at everything. but I don't think we need to. I really think that there is so much to be said for, of course, looking at the structures, looking at function, the movement, but then paying attention to the undertone of a blockage. And what that can look like is sometimes it's a tone change, sometimes it's a coloration shift. Even yesterday I was working with a patient and he had some puffiness in his eye. And as I was working on him manually, I was working on his face and we were really working on his breathing. Okay, is the frontal bone trapping a little bit right there in response to his breathing, the nasal bone? Like what's going on with the mechanics of his nasal breathing, and just some support through, the palate, giving that manual input. And then all of a sudden he was like, oh, it smells funny. It smells interesting. What is that? Then to realize he actually had a little bit of a nosebleed, and it was not in response to my touch, but he had that earlier. We could see inside his nose. It was kind of caked and dry. And then he was able to blow his nose, which he hadn't been prior to me doing that input. But it was because I visibly saw this blockage through, his face and his eye. It was affecting his breathing. All of a sudden, as he's breathing better through his nose, he's sensing differently. He's smelling differently. We're able to move through that. And then that blockage was able to actually move. Like he could feel drainage down his throat. And so sometimes we need to have that understanding of how the system's connected. Absolutely. That's why, anyone that's in this airway space, we take so many courses, some in our scope, some not, because we have to understand more fully how the body works together. And that helps us to really parcel out when we have a breakdown in the connections, when we have a breakdown in the signaling, because you can have things that are connected, but it doesn't mean that the brain is getting that signal in an organized way to the periphery or to, the muscle fibers themselves, to the nervous system of how that tone is being engaged on both sides of the hemisphere, things like that. These are the cues we want to be listening to, what we want to be paying attention to. So a couple of challenges that I would love for you all to just consider is doing a body scan, having your patient come in. Yes, you're going to be doing, if you've done any of the extensive myofunctional course work, then you are already looking at like symmetry in the body, asymmetry, and how, where do we see these things lining up in the body? But I want you to take it a step further and actually look at where is your attention being pulled when you're watching this person. And it's okay if you feel for a moment that you're like, I don't know, I don't notice anything. Practice this. Practice paying attention to microsignals. And, in the Intuitive MyoHacker, we talk about these microsignals and how to really identify specific ones, and sometimes even things to ignore, because you can find that your body will start to pay attention to things. And sure, you might see these symptom types of distractions on the surface, which of course we always want to address, but really we want to be looking at underlying concerns as well. Okay, so maybe this kiddo has a really runny nose and they're super congested, but your nervous system, your attention is actually really pulling you to that distended belly. And you're seeing, okay, what's going on in regards to their core engagement, to the microbiome. And we're not testing that in that moment, but you might find that your nervous system is really tuned in to something else other than that distracting sniffling. And of course, we want the nasal breathing engaged, but let's say there's this inflammatory response that's systemic, and you are noticing it more in how the gut is engaged, more in how the abdominis rectus is just kind of hanging out. Like, what is happening from this anterior fascial plane to the posterior fascial plane connection? Are they even connected? Do you feel, if you put your hands on them, can you tell, are they actually engaged in the front and the back of the body in a balanced way? Most of us are not, but listen, maybe they are. Maybe that's not the case. Maybe it's the lateral fascial planes that we need to be just really paying attention to. Maybe it's the cross hemisphere from like shoulder to the hip. Where is this disconnect, or where is it disorganized? Most of the time, it's not that it's disconnected. That's more what we're going to see in, a stroke or different types of things. The corpus callosum is not there, or things, you can have midline structural shifts that actually impact that communication in the body. But what I tend to see more is because we have adapted in such a way to our tethered oral tissues, to all the containers we're moving around in, to just the pattern of life, that in those movements or non-movements that we have created these maladaptive patterns. So that is where we then can help people with these movements to shift through it, to get out of an adaptive pattern that has moved them into pain, move them into asymmetry, and to help them get more into balanced breathing, balanced swallowing, balanced just habitation of their body. That is truly the outcome that we want to have, is that our patients are able to thrive, to grow in a vibrant way. So if you want to learn more about this, reach out to me. I do have my next cohort coming up for the Intuitive MyoHacker, and we talk about this more in depth. If this sounded too crazy to you, I'm glad you listened to the end. It's amazing to listen to something that you don't agree with all the way through. So well done for you. I hope you guys have an amazing day, and stay tuned for the next episode of the MyoHacker podcast. I hope you have enjoyed this episode of the MyoHacker podcast. Remember, small changes can make big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review wherever you get your podcasts. This way, more families will learn about this important information, and we can make a bigger impact. Head on over to myohackerslp.com for in-depth resources and guides. You can also join me on Instagram at myohackerslp for bonus content and demos. And if you have questions or topic suggestions for future episodes, send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection and breathing. Quick disclaimer reminder: the content shared in this podcast is for informational and entertainment purposes only.